Learning about your anatomy and asking hard questions like how do I increase my sexual pleasure and do I have pelvic floor dysfunction can be challenging. So get the answers to all of these questions and so much more in this Instagram Live. Hi, my name's Laura, and on this channel, I help you gain optimal health through knowledge and movement.
Hi everyone, we're just gonna give a few minutes for more people to tune in. But today I'm gonna be going live with Dr. Laura, who is a pelvic floor therapist. And we're gonna be discussing all things related to the pelvic floor. And you're probably wondering, what is a pelvic floor? And I'm going to tell you that you're gonna know after this live.
Hello!
Hi!
Sorry for my delay.
No, you're
Just
good.
finished
You're good.
with
You're
the
fine.
patient and they forgot their keys. So we are all ready.
Yay! All right. Are you good? Are you comfortable?
I am good. Yes, I'm just
right.
getting my phone set up. I'm so pumped.
Okie dokie. Well, again, for everyone who is tuning in, I'm going to be having a conversation today with Dr. Laura, who is a pelvic floor therapist and is basically an expert in everything as it pertains to the pelvic floor and beyond. We're going to be answering some of the questions that you submitted last week, as well as any other additional information that Dr. Laura wants to talk about. So to begin, I guess, Dr. Laura, you could just tell us, where you're joining us from, what's your background?
Yes. So I am in Rochester, Minnesota right now, and I am joining you from my lovely townhome, which is where I treat patients. I'm so excited about being able to work from home because I get to create this amazing, lovely, relaxing space. A little bit of a background about me. I graduated with a degree in athletic training, and then I went on to get a doctoral degree in physical therapy. After I graduated in 2012 with my physical therapy degree, I went ahead and did further education all about the pelvic floor. And I just absolutely love it. And I have also gotten training to do yoga and restorative yoga and all of those things. So really, I can see any type of issue or injury that you might see a typical physical therapist for, but I have really directed all of my continuing education to focus on treating the pelvic floor, and so that's where I like to spend most of my time.
Okay, why the pelvic floor? Just wondering.
Yeah, so okay, so the fun answer is when I was going to PT school, we had these individuals come in and talk about specialty practices. So there are other specialty practices within physical therapy, like pediatrics, where you're working with kids, or people who work with spinal cord injuries. And so one of the groups that came in was individuals that work with pelvic floor. And I'm the type of individual who sits in the front of the class. And I always like to know, what additional reading do we need to do to prep for the next day? So I raised my hand and I'm like, what homework do we need to do for tomorrow? Blah, 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 blah. And they said, the only homework you have to do is go home and have an orgasm. And yes, that was my response. I laughed hysterically, and they were dead serious. And I was like, I feel like I can get around this. So I immediately after that went and asked to have a clinical rotation, where I then spent 9 weeks observing and working with pelvic floor patients. And really, that's where I saw people come in with things that were so personal and so private. And I saw how there was such power in listening to them and allowing them to speak their story, their truth. And then I could do something about it. I could not only listen, but I could actually give them tools to get better. And I just have always had this special gift of being able to talk to people about really personal, private things. And I didn't really realize that it was a gift until I started working with pelvic floor patients. And until I started also realizing, like, I'll be out at the grocery store and like someone will suddenly start telling me their life story. And I just always thought, like, oh, that happens to everyone. But actually, I think just must be something about me. So the fun answer is the orgasm thing. And then the more serious answer is I really saw that there were people truly hurting and that there was a way to help them. And there wasn't very many therapists who did this and who could do it well. And so I felt that I could do it well.
Well, you're doing it well,
yes.
As far as I know.
Thank you.
Okay, but so to start, we're gonna just start with talking about what even is the pelvic floor. I've had a few of my followers wondering, is it a bone? Is it a set of muscles? So I think you're the appropriate person to answer that.
Yes. Yes, totally. So the pelvic floor is this beautiful group of 26 muscles. So think of it as a bowl, and it attaches at the front of your pubic bone, which is the bone that if you put your fingertips just below your belly button and you walk your fingertips down your belly button to that firm bone, they attach at that bone, and then they run like a sling or a hammock and attach into our tailbone and the bottom part of our spine. So they create this whole structure that gives support to our spine and hips. It helps with our sexual appreciation. It helps to hold our pelvic organs up and in place, and it deals with our continence of our bowel and bladder. And so these 26 muscles aren't kind of one layer. They actually are like a 3D spider web where our different outlets, whether it's our urethra, where we urinate from, our rectum, our vagina, all of that kind of goes through those outlets, and they help provide stability. So it's really fascinating, and it does not matter what gender you are. Everyone has 26 muscles. And that's one of the things that I think is the coolest, because there's not actually that huge of a difference between a pelvic floor where you have like a phallus or a penis and a pelvic floor where there's a vulva and vagina. And I love that sort of equaling factor, or equaling the playing field.
Good. So a question that a user had is that you're talking about there's no difference between, like, if you're a female-bodied individual or a male-bodied individual, but what about for intersex individuals?
Yes. Yeah. So intersex is really interesting. I have worked with several intersex patients, and probably many more that I wasn't even aware of over the years. So with intersex, what can be interesting about that is, for me at least, was depending on kind of where in this range that someone found out they were intersex. So, for example, I had worked with an individual who never knew that they were intersex. I knew it because I had gone back really far in their medical record, because I was looking through their surgical history. And when they were a child, they had a surgery where they actually had their testicles removed. So then, because of that, I knew that the muscle orientation was just slightly different. So For someone who is a male-bodied individual, the layer 1 muscles are actually together where they create a column. And for female-bodied individuals, there's a split where we have this thing called the urogenital hiatus. So I knew for that individual, I might have to address these muscles a little bit differently. The other thing that comes into play for intersex individuals can be if they have like a uterus, or if they have ovaries. We might have to pay attention to how ligaments and how things are sort of attached within their body, within their system. Or if those things have been removed, that kind of can change how their spine is stabilized. So a lot of this, for me, how it plays out is that individuals will come to me and they're suffering from bowel or bladder continence issues, back pain or hip pain issues, pain with intercourse. And then I'm kind of trying to go back and figure out where in this is there, like where in this did things sort of go awry? And it looks like we have a question of what is intersex.
Yeah.
I don't know if you want to take that or if you want me to answer it.
If you want to answer, you're free to, but I can as well. So
you can go ahead and do it.
So to the best of my ability in explaining, an intersex individual is an individual who has some reproductive or genital parts that resemble both male and female anatomy. And as far as I know, when an individual is intersex and they are born, typically it is up to like the parents' discretion if they want to choose like what genitals their child wants to have.
Yes.
So, yeah.
Yes. And that's where it can be so challenging, because if you go back through the medical history, the person may or may not know, depending on how far they've gone back in their history, how upfront their parents have been. So for me, I really try to try to see. Usually people have been coming to me and I know they're intersex. And so we can kind of go back from there. And I've only had a few where they didn't know. So I had talked with their medical team and we had decided that because it was so long ago, we weren't really going to bring it up unless it really impacted their plan of care. So it can be really challenging, but again, for me, I always go back to the anatomy and try to think, okay, so there was a uterus here, now there isn't. How did that change the anatomical structure, and what do I need to do to help them feel better? Or, okay, there was, say, a prostate here or whatever. How does that change the anatomical structure, and what do I need to do to help them feel better?
Cool. So let's talk about dysfunctions and disorders of the pelvic floor. We know what it is, but obviously it has like a lot of, functions, especially as it pertains to stability and sexual function.
Yes.
So a question I had from a user was, how important is the pelvic floor for sexual pleasure?
Yes.
What exactly does it do for sexual
Yes.
pleasure? And like, what are some disorders that can impact someone's like ability to orgasm because of the pelvic floor?
Yes. Yeah. So actually, I love like anatomy models.
We love models.
I'm such a anatomy geek. Let me go ahead. I have my little closet of stuff here. Let me get my models. All the things. Okay. So let's grab one more thing. So, okay, I think I have everything. Okay, so the pelvic floor. So here's our pelvis. This is a female-bodied pelvis. Okay, so here is where our vulva would be. This is the clitoris. This is the urethra. This is the vaginal opening. Here's the rectum. So if I show you the same thing here on my vulva puppet, we have the clitoris, the urethra, the vaginal opening, okay? The interesting thing about both of these, how they depict the clitoris, is that they depict it as this little nub, okay? When in actuality, the clitoris is this entire thing, okay? So, the clitoris actually lays in between layers 1 and 2 of our pelvic floor. So what you're seeing, here's where we see that nub. But in actuality, here is what is laying underneath. So when people say, oh, I have a G spot, or did I oh, someone's hitting my G spot, really they're getting to these deeper kind of nerve endings of the clitoris. So because the clitoris is so enmeshed within these muscles, because the nerves, if you were to look at them, they sort of come in like this. We have a clitoral nerve, all of this, like it goes exactly like my 3 fingers here, like that. So when those are excited, if a muscle is just held tight like this, there's not a ton of room to kind of move and get those nerves to kind of friction up and get excited. And so we want to have strong pelvic floor muscles, but we also want flexible pelvic floor muscles. So then that way, when we have, whether it's penetration or if we're having stimulation at the clitoris, we can have the skin and the muscles sort of move and slide and glide over each other, so all 8,000 nerve endings can be stimulated and not just the nerve endings that are on the tip or the head of the clitoris. Okay, so that's the clitoris. If we think now about, okay, you're gonna laugh, I swear to God. So I wanted this to be, first of all, there are no penis puppets. There's one, but it's actually a neck pillow. And I wanted it to be the same as my vulva puppet. So I got this suction cup dildo thing. My boyfriend thinks it's insane, and I like to freak him out and stick it at different places around our house, just to screw with him. So anyway, if we're thinking about the penis, basically what happens is when this clitoris, when we're going through, when we're developing as little babies, as kids, what will happen is this part through here and this head, it elongates and stretches out. So the head now is the head here. So that's so they're very, very similar. The difference is when we're dealing with a penis, what has to happen is these pelvic floor muscles, specifically these muscles right here, which are known as our ischiocavernosus, have to tighten to hold blood into the shaft of the penis. So that's where when people have erectile dysfunction, it can be because those muscles can't clamp down to hold the blood flow in there. So pelvic floor muscles, I think oftentimes when we're thinking about sex, everyone always thinks stronger is better. But I always argue that flexible is better, or having more muscle awareness is better. So a simple exercise anyone who's listening now or later can do is just seeing if you think about the space between the 2 bones that you're sitting on. So your 2 sits bones, if you think about that space right in between, so kind of your perineum, which is right behind the vaginal opening or right behind your testicles, think about lifting that up or like you're trying not to pass gas, that's a tightening of the pelvic floor. And then you want to let go of that tightening. So many times we always think about tighten, 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 but really to stimulate the nerves and to get good blood flow to this area, it's about the ability to tighten and fully relax, tighten and fully relax. Because that's what orgasm is. Orgasm is a fluttering of those muscles. So if they're just held tight all the time, we're not going to get blood flow. We're not going to get that fluttering or that orgasm. So, takeaway points, increasing muscle awareness, and really focusing on flexibility, which you can do through deep breathing.
Okay. Yeah. Now, so can you actually briefly touch upon like Kegel exercises? Because we talk about like the pelvic floor, people say use Kegel exercises to strengthen it.
Yes. So funny thing, Kegel exercises was named a male physician, named those exercises, of course, white male physician. So you can refer to them as Kegel exercises or just pelvic floor strengthening. Many times I see them highlighted in magazines, and they tell people to stop the flow of urine, like to see if your muscles are strong enough, which we don't want you to do that, because when you stop the flow of urine, you're actually can predispose yourself to a urinary tract infection. So don't do that. The easiest way to practice Kegel exercises or pelvic floor strengthening is to lay on your back or sit. And when you lay on your back or sit, you're again, like I was saying, focusing on that space right behind your testicles or right behind your vagina, that perineum. And you will think about stopping, like as if you're stopping the flow of urine or as if you're trying to not pass gas. And you should feel a tightening, a firming, a lifting. So I'll have people do that, and I'll have them put their words around it. So to me, if I do it right now, to me, it feels like my muscles are going like this. So a drawing in. And then when I release that pressure, to me, it just feels like a letting go. I had several clients tell me it feels like grounding. It feels like releasing. It feels like, oh my gosh, I might pass gas. So kind of figuring out your own words around it. And then if we really want to focus on true strengthening, which is what you're really asking about, then it's just like strengthening any other muscle in our body. We want to challenge it. So I will actually write out and say, okay, I'm going to have you hold that contraction for 3 seconds, and you're going to do 10 repetitions, 3 sets. And then you're going to do that every other day. And then once that feels easy, we're going to increase it to 12 repetitions and 15 repetitions. And ideally, you would like to be able to hold 10 seconds for 10 repetitions.
Okay.
But the number of people that I have seen be able to successfully do that, honestly, has been like 2 people in 9 years of physical therapy. And the reason why is because strength doesn't always correlate or connect with function. So like, think about it. Like I can get on a bike and I can bike. I might not be the strongest person or the most coordinated person or the fastest person, but I can still do that activity. So my question to individuals who think that they need a strong pelvic floor is why do you think you need that? What are you trying to get after? And so people that are seeing me are often saying, I want a more powerful orgasm. I don't want to leak when I'm running. Well, there are other ways that we can get to that. And there are probably other problems, like maybe you don't know that your clitoris is looking like this. And so all you're doing is you're just stimulating here only, instead of stimulating these other beautiful areas that will give you sexual pleasure. And we need to have more of a conversation around that.
Yeah. And actually, I think that's like a good segue into another user question. So someone asked about for female-bodied individuals, is there an assumption that a weak pelvic floor means having a weak or loose vagina? So, yeah.
Yes.
So what do you?
So a weak pelvic floor, from my perspective and from what I've seen clinically, does not mean that you have a weak or loose vagina. Because individuals who I have seen, honestly, who I would say, man, their vagina seems loose, what has happened is they have had some type of trauma. And when I say trauma, what that typically looks like is they've had a baby and the baby has been large, or their delivery didn't go as planned. And so they had some type of tearing or something like that. And so the skin is actually stretched, and the connective tissue. So this model doesn't show it well, but if you ever peel an orange, and you know how when you peel an orange, how the orange has like its own little separate like sections to it, that's how our muscles look like. And so after delivering a baby or having the delivery not go as planned, those connective tissues are stretched out. So that is where I see people have more of this like loose vagina type thing. And with that, we need to allow time for the tissues to tighten, and then we might start to work on strengthening appropriately.
Okay.
So it tends to be after an event versus with aging, or just like, okay, like I'm a 35-year-old person, I haven't had any kids. It's not like suddenly it would just become loose.
Yeah. Okay. And another great segue. So before this live, I was like doing a little bit of research, and I found a study about the prevalence and awareness of understanding pelvic floor disorders in adolescents. And what the study found was that women ages 25 to 30 had way more awareness than adolescents did as it pertains to their pelvic floor. So I wanted to have your thoughts about like what are the implications of our youth, adolescents not knowing about their anatomy, especially their pelvic floor anatomy.
Right. So this is like one of the reasons why I got into what I'm doing, where I'm trying to have such a presence online, is for this youth and adolescent population. So like, it is so weird to me that you go through sex education and you don't cover anatomy. Like, I don't understand how you can cover anatomy, but then also cover like, or how you cannot cover anatomy, but then cover like safe sex practices. Like, for me, who's a nuts and bolts kind of person, it doesn't make sense of like, well, if you're not telling me how these things go together, or what if you're not, like, what if you're a transgender person, or what if you're, what if you're homosexual? Like, how do we cover how these things work, and what pleasure is, and what to expect from doctors, and how to be able to teach our children how to vocalize what their boundaries are, and what is good touch and bad touch, and all of these things, and communicate with medical professionals if we're not telling them and explaining what our anatomy is. And so I think it is paramount that we need to start educating kids younger about what are their parts. If they're a male-bodied person, what are female-bodied parts? How do they work? What are their functions? Friend tried to call there. What are their parts? What are their functions? All of that stuff, because that is so, so important. Because we would be able to catch things a lot sooner. We would be able to treat people a lot sooner if they could vocalize it. But if you don't give someone the vocabulary to say, I'm having this problem, then what ends up happening is they get to 25, 30, 35, 40, and then they're coming forward because then they've finally gotten the language to be able to say, hey, I have this problem, or I've had this issue for a while. And there's so much research that shows the earlier we intervene, the better. So I personally think it should fall on, I wish we could increase parents' health literacy. I wish we could increase parents' anatomy literacy. And then I wish that we could increase access to good health information within the school system. So I see someone said I didn't have sex education. And yeah, I think sex education, health education, I mean, to me, vaginas, rectums, penises, I see them so much, I talk about them so much, it's the equivalent of if I talked about like a nose all day. Like, it's so common to me. I don't understand why it needs to be this bad, shameful thing. I think that the more we speak it, the less power it has to be shameful, and it really shouldn't be shameful.
What would you say are like some tips to like getting people to be more comfortable with talking about their anatomy? Because already there is a lot of stigma, but I think there's like a movement going forward with us being more comfortable about that. But how would you? Yeah. So, well, I think having amazing resources, like you, I love the stuff that you create. I've been following it for a while, and I think that elevating voices and platforms like yours is huge, because I think that there is this move that we want to have, people be able to be more comfortable. And so we need to get platforms like yours in front of those individuals to see that it's more normal. I think I have become very aware in the past probably 6 weeks about the lack of education that people receive in schools around anatomy. I knew it wasn't great, but I didn't know like to the extent or the degree. Yeah. And I also, because many of my friends are medical professionals, they use anatomical terms with their children. So it wasn't until I honestly got more followers on my account and I started talking about it more, and people started telling me like, oh my gosh, I do not talk about this stuff with my kid, or like, no, we do not cover this. And I'm like, what? And so then it just got me thinking like, okay, like what can I do to, be more impactful and better about it? So I know I have a future workshop that I would like to do where I basically teach parents how to talk to their kids about their body and about sex education and all of that. So that's definitely a future project that I want to do because I think that parents just try to do the best that they can do. And if they don't have the health literacy and the health knowledge and the comfort, how can we affect this next generation? And so if I can equip them with that, then okay, perfect. Then we're starting to close that gap of access. And that's something that I think is so important. So talking about access, I want to talk about access to treatments. So
yes.
Again, looking at more research and things of that sort, found another study talking about racial disparities in knowledge about the pelvic floor. And it was found that Black women in particular know way less about the pelvic floor and disorders and dysfunctions and anything of that sort in comparison to their white counterparts. So further research, I was seeing that approximately 30% of Black women have access to Medicaid. So does Medicaid cover therapy for pelvic floor dysfunctions?
Yes, they do cover therapy for pelvic floor dysfunctions. You have to get a referral from your doctor. So I think that that's a huge thing of it. I honestly think, again, getting I like to get as much free information out there and getting on different platforms such as these to be able to share this information, because I can't tell you how many times I've had patients be like, I've been telling my doctor about this forever. And so sometimes the issue is not, do you have the insurance to get to me? It's, does the person you're seeing, the referral source that would refer you to me, do they have the knowledge to get you to me? And so that's a big thing. And I think doctors, and I wonder if some of the doctors that these individuals would be going to, if they're seeing way more patients than the average person, so they have less time with the patient. So they're like, I'm just going to give you a medicine instead of telling you the benefits of going to physical therapy. I think that is probably a huge part of the puzzle, because if you have a physician who is seeing Medicare patients, they probably have to see more Medicare patients to keep their doors open, which means the patient is not getting the one-on-one care that they need. So it's so important to help people know this is what's normal and this is what's abnormal, and you need to go into your doctor and demand physical therapy and demand that you get care, because it is covered if you have a referral. And we want you to have that help. And another statistic, I don't know if you saw this, I shared this on my page, I think it was last week maybe, about the rate that Black and Indigenous people of color are dying with delivery when they're absolutely. yeah and so that is something where physical therapists aren't really included within that group of caring for people. We should be, but I think that having another team member to be able to see these patients more frequently and see hey, there are some red flag symptoms here, we need to we need to be paying attention to this, I think is so huge and so important. And so my way of kind of closing that access gap is, again, creating these free resources and these free information things so that patients can go in and feel more equipped to advocate. That's just what my mom kind of showed me growing up. I remember her coming in with a legal pad of paper and being saying to the doctor, I'm not leaving your office until every single one of my questions is answered on this legal pad. And the doctor being okay. And I remember them checking the looking at the time, and she's you can look at the time all you want, but I've waited and waited and waited for my appointment, and I have these concerns, and they need to be met. And so because I've had the privilege to go get a higher education, and I have all of these things in my brain, and I had a mom who went in and did that, I'm okay, not everyone can decipher through Googling all of this stuff and being able to create this list in their brain. So I need to get this stuff in my brain on my blog so people can print it off and be hey, Laura talked about that, urinary incontinence that's lasting greater than 6 weeks after I had a baby is not normal, or pain with intercourse is not normal. And this is how I go to a PT, and this is how I advocate with insurance. And I have blogs and resources so that people can then take that to their provider and say, like, no, this is what is evidence-based and I deserve this. Because insurance does pay for it. So yeah, that's my little soapbox. Sorry. I feel like I feel really passionate about that. And it like just pisses me off. Like whenever I hear patients be like, oh, the doctor didn't listen to me, or, oh, this didn't happen. I'm like, God damn it.
I actually have like a follow-up question for you regarding that. So here at the Vulvarity Project, we work to center marginalized voices, and as many of us know, Black women, people of color in general, but particularly Black women's pain is received as less than what it actually is by medical professionals. So, you know, you're saying that Black women or people in general should be going forward with their doctors and saying, like, I demand this, I need help, I'm having pain, and their voices are still not being heard because of all types of systemic oppressions. To what extent, I guess, like, are pelvic floor therapists or PTs like doing advocacy work in this realm, especially since they typicically deal with like pain disorders?
Yeah. So I would say, so, I'm gonna be honest, I'm new to this advocacy, advocacy group. I not that long ago started working with transgender patients, and also with everything that has been coming to the forefront with Black Lives Matter and everything. Even prior to that, I knew the numbers with individuals going through delivery and all of that, and I still struggle with knowing how to be a good advocate. And so I know what I have done is I've gone within my team to say, okay, how can we be better? What do we need to do on my platform? What do I need to do so that I can be better and advocate? So I would say, from what I witness of my pelvic floor colleagues, I don't think that we do a great job. I think that I wonder if one of the reasons why we're not doing a great job is because so many people are already not getting to us. Like, I can't tell you how many times I will tell a physician, a nurse practitioner, a PA, whoever, I treat these conditions. They'll send me 5, 10 patients, and then suddenly they'll stop sending me patients. And then I'll reach out to them again. They'll be like, oh my gosh, I totally forgot about you. And I'm like, forgot about me? Like, how the heck can you forget about me? Like, I'm helping you with your patient load. Like, we're helping people here. And so, for my perspective, I'm just trying to fight to stay in front of people, to get any referral and to help any person. And so let alone get in front of someone to help a marginalized group, you know? And so I know, that's something that I can do better on. And so that's why I'm really excited about, being more active since I left a large medical institution, and now being more active on social media so that I can do some more of this advocacy work and spread these numbers so I can increase that awareness. But I would say, as a pelvic floor demographic, it's like, I can't tell you how many times people will just be like, oh, well, I just forgot about you. Like, oh, I didn't know I should send the person to you. It's like, okay, well, like, your patient hasn't been getting better. Why wouldn't you send it to us? Like, even if it's a Hail Mary, again, it's another member of the team. So I know one thing that we're going to be doing for Laura Meihofer LLC is we're going to be going on Pinterest. So a lot of these things that I'm talking about to help people advocate, we're going to be making like printables so that you could go in and you could print off something and be like, this is what you need to outline for your doctor. Or like, here is a factoid of like, for a Black female, these are the things you need to know. These are the snippets that you need to be aware of. So when you go into your doctor, like, you have the printout to say, like, here's what the evidence says. So it's easy for me to read a bunch of articles and synthesize it so then the patient has it and then they can go. Because I tell you what, when I equip patients with knowledge and they go say that to the doctor, whether they've been Indigenous, Black, or transgender, that makes the doctor shut up real quick when it's like, well, here's the most up-to-date evidence in the last 5 years. This is what I need from you, then that's been really helpful. So that's what I have been trying to do, is I try to tell everyone I'm trying to make you a physical therapist so that you are taken seriously. So it's not just you coming in like my mom and demanding this. It's you coming in and demanding this, but here are the facts. So even though you shouldn't have to demand that, like you were saying, like, it shouldn't even get to that point. But since it is, why don't I just give you another tool, another weapon to make sure that you don't get, like, effed over? Excuse the language, but, like,
no, you're good.
that's just what I feel, because it like makes me so irritated.
Yeah, no, I think it's, like, really important to, like, equip people with that knowledge and that information, because, like, you know, some medical professionals probably prey on the fact that people don't know anything about their bodies or about the healthcare system. So I think it will be, like, hugely beneficial to have, like, a document saying, I know what's going on, this is what I need from you, get it for me, you know?
Right. And, like, and even, like, my thing has been, okay, so like, with these pregnancy related deaths, we'll say, so one of the things that showed is that, okay, there can be some symptoms that are slightly different. Okay, then let's make a simple infographic that shows what those symptoms are. And then that way the patient can have it. First of all, as a medical professional, you should already know that. Like, I expect excellence for myself. So I should already know that. Clearly, other medical professionals, whatever, they're not doing that. So then I want that patient to have it so that when they come in, they can say, like, hey, I'm feeling this, or whatever the case may be. Interestingly, I tried to write an opinion piece for my local paper. I asked if they would let me write an opinion piece on pelvic floor dysfunction and access to care and all of that. And the response I got just yesterday was, this is not a large enough demographic to matter to our community. So I was like, all right, I'm going to go to the evidence and I'm going to get the numbers, because I always forget them. You'd think I'd have them drilled in my head, of what is the prevalence of these different numbers, and then say, like, okay, so you think it doesn't affect you, but of course this was a white man. And it's like, a white man is dictating what an opinion piece is going to be or not be for this community, and he's determined that access to pelvic floor physical therapy is and better serving our community, that is not good enough for an opinion piece. And it's like,
yeah.
So I just was, like, so mad, and I'm like, okay, the only way I can communicate with this person is to, like, respond with some statistics and then just be like, I don't know, you suck. So, and then he said, like, something like, this would be better suited for a blog, is what he told me. And I was like, right, I told you, look at my blogs that I've already written. I was requesting a larger platform. So I think, until people start recognizing it, pelvic floor dysfunction is something that happens to a lot of people. The best advocacy I can do is try to equip people with knowledge so that they can go in and demand things like my mom did, like I do, but they have the facts and the stats that I already have in my brain. And the only reason why I have them in my brain is because I got this doctorate degree. So, okay, other people don't have that. That's fine. I can equip you with that.
Yeah. So, like, I don't know, I feel like equipping doctors with the information may like be something that's easier done for like older individuals, but again, for like our youth, like how would they go about doing that? And then also, like, I believe that you work with a lot of youth. I don't hear about a lot of, pelvic floor therapists like working with youth. So if you want to talk a little bit about that.
Yeah, so I actually was really have been really inspired by, I have 3 nieces and 2 nephews, and I've always been really inspired by them. And because of them, I have always wanted to just take care of kids. And that was the other thing I wanted to get into, was either, if I didn't do pelvic floor PT, was pediatrics. And so I think that many physical therapists are afraid to work with pelvic floor physical therapists are afraid to work with kids because they think like, oh, okay, again, we're talking about this shameful area of our body. Like, I don't want them to think that I'm taking advantage of them. There's the whole Larry Nassar thing with US gymnastics. And so a lot of times kids, I think, don't get taken seriously, or they sort of get lost in the shuffle because people are like, I don't want to assess them. I don't want to put them through the trauma of a pelvic exam. Okay, but if a kid is walking around and they're 16 years old and they're having incontinence and they can't participate in gym class, they're having pain because they can't put in a tampon and so they can't participate, that's more traumatizing. So I love working with youth and having real conversations about them and letting them start to become members in deciding their care and treating them like adults and humans and people that can make decisions, because they can. And I think that kids don't get that enough. I think they're not taken seriously enough. And people just assume like, oh, my kid's 16, they're not going out and doing anything. And it's like, well, this person might not be promiscuous, but they might have a goal to be able to wear a tampon so they can go to the pool in the summer. So I think that treating them with respect and being really honest with them about what your goals are, why your goals are what they are. I teach them the anatomy, all of that. It might take us longer to get through some of the stuff, but we have a lot of success with it because they're like one of my favorite populations to treat, because they're like so game and they're like, okay, I get it, let's do it. And they feel collaboration instead of me dictating to them.
And then regarding like referrals, like you said that you can't have individuals come to you unless there's a referral. For youth in particular, those under 18, is there like a waiver or anything that has to be signed by parents when they
so that's a really great question. So, and as far as referring to get to me, so every state is different. Technically in Minnesota, we are a direct access state, meaning you can come to me without a referral, but insurance might not cover it. So that's the caveat. So some insurances will cover even if you come directly to me. Many of them will not, and you need the referral. So check with your insurance. Regarding with kids, I don't have a parent sign anything. I just have the kid come to me, and I just do really careful documentation. So and then I haven't had a case where I've had a kid come to me that's under 18 that I needed to do a pelvic exam and a parent wasn't involved. I've always had a parent be to some degree involved. If a parent wasn't involved, I'd want to dig a little bit deeper as to why the parent wasn't involved, and then go from there and probably speak to my lawyers. But otherwise, no, I never have the parents like sign anything. It's usually I just document it.
Okay. Mm-hmm. Okay, so we're running a little bit short on time, about 5 minutes left, so got a few more questions. So Someone asked, what are some common symptoms of pelvic floor dysfunction, and how do they like differ from, like, how do you know that it's true pain and something that you should be like seeking help for in comparison to like PMS or something?
Yes. So, okay. So the pain thing, that is a really easy differentiating factor is if your pain is always cyclical. So I'll have people do a pain diary, or sometimes even before they go to their doctor, they'll do a pain diary. And if it's like, okay, my pain started on this date, and then 3 days later my period started, and so they'll kind of document out on a 10-point scale, where is their pain, what are they feeling. And so if we see over, say, the course of 3 or 4 months, it's always the same, then that tells me the pain is more related to something with their cycle, and we need to have a physician kind of rule in or rule out what we need to do to better address that cycle. If it's more related to the pelvic floor, we will not see those cyclical patterns. It will sort of be constant. So it'll be like this pain is always present. Maybe the pain, if it's pain related, it will be like before I go to the bathroom, after I empty my bladder, after I take my tampon out, while my tampon's in, after intercourse, during intercourse. So we'll see it related to sort of an action, or it's just always there, versus I can look at my calendar and it's kind of always the same every month.
Okay. And then like as in regard to like seeking treatment, like approximately how long is the treatment process for like treating pelvic floor?
Yeah, so it can be variable. Generally, I would say I'm seeing someone for anywhere between 6 to probably like 18 visits. And it depends on how compliant they are with the home program. And also kind of if it's more something pain related, how their stress management is with their normal life. Like I just had a slew of patients that were doing a lot better, and then they had a bunch of stress events happen, and so their pain came back up, and we had to backtrack a little bit, and now we're building on it. So but I would say generally it's around like 4 to 12, but if it's pain, usually I have to see them a little bit more.
Okay. And then again, talking about lack of access, barriers to care, and all that, some people just cannot make it out and get the treatment that they need. So like, what are some ways to remedy like pelvic floor pain at home?
Yes. So if you go to my YouTube channel, Laura Meihofer, LLC, I have a playlist that is called Yoga Exercises for Your Pelvic Floor. Pick 2 to 3 of those. Do them 2 to 3 times a day, holding for 90 seconds. Unless it's cat-cow, then do 10 repetitions. And do that coupled with the deep breathing. And I have a how to do deep breathing video there as well. And that is awesome. And then also start using like a hot pack on your abdomen 3 times a day. So those are like my go-to things. That YouTube channel also has a lot of good information about like what is the pelvic floor and how to find a therapist in your area. So I created that resource to make my job easier. So those are the videos that I'm giving out to patients. So that's like basically like you're getting therapy from me without having to pay for it.
Cool. Okay, so Instagram's about to cut us off for about 40 minutes, so I just want to say thank you, Dr. Laura, for coming to speak with me on my platform. Super appreciative. Everyone who's watching and everyone who will watch, please follow Dr. Laura on her social medias. Laura Meihofer at Clitoris Collective, laurameihofer.com, her YouTube channel, all of those things if you're interested in learning more about how to deal with pelvic floor pain, as well as just learn about it in general. And if you have any closing comments, we have like 15 seconds left.
Just thank you. I'm sorry it was late. You were amazing.
Okay, so thank you for joining us, everyone, and I will see you at another time. Thank
Bye.
you. Bye.
If you want to get the full rundown about the pelvic floor, click that playlist and I'll see you over there.